Good evening. It is just one of two dental clinics in Rochester treating low-income families. But a 13 WHAM investigation into small smiles raises questions over whether children are being traumatized or receiving proper care. Small Smiles branches across the county or country are under criminal investigation. Baby root canals, crowns, mouths full of metal caps. Tonight, we take a closer look at the growing problem of severe dental decay in toddlers. 13 WHAM's Jane Flash spends a day at the Eastman Dental Center for this follow-up report.
An operating room at Strong Memorial Hospital. What brings a surgical team here today is tooth decay.
You see, those are pretty big holes.
So big, in at least one rear molar, you can see all the way to the gum line. 4 front teeth are even worse.
The decay probably compromises the whole crown of the tooth.
Doctors will struggle to try to save 11 teeth today, all for a patient who just turned 4 years old.
We see children 2, 3, 4 years of age with extensive dental decay that need multiple and complex dental restorations.
You brushing every day? You're doing a great job.
Zaina Hill is a regular visitor to the Eastman Dental Center. She's had cleanings every 6 months since she was 3. Yet by age 3, it's already too late for some.
These kids show up on our doorstep with advanced decay.
This is what is known as baby bottle tooth decay. When kids go to bed with sugary drinks, even milk, their teeth often don't make it through their toddler years. Advanced tooth decay in toddlers is a growing problem which especially impacts low-income families. 4 out of 5 dentists won't see Medicaid patients. With fewer options, families forego treatment, often until their children suffer severe toothaches. By the time a dentist gets involved, it is already an emergency. Across town, Small Smiles is part of a nationwide chain of dental clinics set up by FORBA to treat children with Medicaid. FORBA stands for For Better Access. But its use of papoose boards to physically restrain children in order to complete multiple baby root canals or crowns is very controversial. The company says it requires parental consent and that the boards are only used to prevent injury. David Douglas Gardner says the real motivation, though, is money. He ran the Rochester office until he was arrested and sent to prison for double billing Medicaid.
The Small Smiles way of taking care of children is to maximize every dollar that they can during that patient visit at all costs.
Terrorizing little people with things like papoose boards is not good health care.
At Eastman Dental Center, young patients are seen by pediatric dentists who have 2 additional years of training in how to work with children.
All right, remember Mr. Thirsty here? You're going to hold on to him.
Zaina participates in her exam.
Sometimes a lot of kids, they're afraid of doctors, dentists. When they're talking to her, it's more so that they're coaching her and letting her know that, she's going to be all right.
The more aggressive treatments, when needed, are done in the OR. And that takes us back to our little 4-year-old patient. Doctors saved 7 of his teeth, but not these front 4.
Regrettably, we're going to have to remove these today.
In this case, though, the young patient sleeps through it all.
It's better for these kids to be admitted to the ambulatory surgical center while they're under general anesthesia and getting medications where they'll forget the whole thing.
Now, we agreed to keep that young patient's identity confidential, but we can tell you that he did wake up from the anesthesia, went home the very same day, and is doing well now. Pediatric dentists say their goal is to prevent the need for these operating room visits. They are now advocating starting dental visits at age 1 to help educate parents and to head off the kind of behaviors that can lead to that chronic decay of baby teeth. And it is shocking to look at.
Well, and I'm going to say, when I think of having a tooth capped as an adult, you hope to get many years out of it. We're talking about capping a baby tooth that's going to fall out, right?
Right, we are, but you got to keep in mind that the dental health, it has a lot more to do than just in your mouth. That a lot of times tooth decay can lead to severe heart problems, it can lead to severe infections elsewhere in the body, and there are even some documented cases of plaque that gets out into the bloodstream and causes stroke and even death. So there are a lot of implications to your overall health, especially starting that young.
All right. Hey, thank you, Jane. By the way, Small Smiles was mentioned on Capitol Hill yesterday. Congressman Dennis Kucinich was critical of Medicaid for reimbursement rates. 4 out of 5 dentists refuse to treat Medicaid patients because the rates are so low. The congressman pointed to the criminal investigation of Small Smiles as an example of what can result.
Small Smiles conceived of another way to make a profit. A predatory mill where multiple, sometimes unnecessary procedures are imposed, assembly line style, on children with little regard for their welfare or proper dental practice.
Medicaid officials told Congress today they are trying to make more dentists available for poor children, but conceded they do have a long way to go.